Remember.
Yes, we are live.
Okay.
A very good evening to one and all who have joined here today for this online webinar session. Today we have a very effective and special topic: 60 days to NEET-PG, an orientation program by none other than our most respected Dr. K. Vinayak Senthil sir. He's the National Faculty for Surgery and Director of Speed Medical Institute. He'll be giving us tips and tricks for the final revision strategy for interns and post-interns appearing for INICET and NEET-PG 2024. Welcome, sir. Now I kindly call upon our founder and chairman of medicine, Dr. Raghunandan Ramanathan, to give us opening remarks.
Good evening to all. So it's my pleasure in welcoming our dear Dr. K. Vinayak Senthil sir for this wonderful session. So I just wanted to tell you a short story how this session was planned. Actually, I went for one of the class organized by him in Mangad Speed Institute. So it was such a wonderful session. They had a short session by Nikita Narwani ma'am, and I was actually one of the student who attended it. So the hospitality and the way the classes was held was totally amazing. And that was my first impression. And that is how I just approached sir. And his motivation at the middle of the sessions was like mind blowing. And it actually gave us more hope to write the exam or more hope to listen to a class per se. So for a long hours when we were sitting, his motivation was actually awesome. And that is the reason why I invited here for this wonderful session today. I thank you, sir, for joining with us today among your schedule. I know that it is going to be a very tough journey for you for the next 2 months as you are preparing for wonderful sessions for students. And in middle of that, you have joined with us today for motivating our students, motivating the interns and post-interns who are appearing for their NEET-PG exam. So the common question which everyone has, whether I will be able to succeed in this exam or whether I will be able to solve the exam and crack this exam when 2 lakh or 3 lakh students are appearing for this. So I think I'm sure that today's session, those who are attending will be getting the answer for all these things, and you will be motivated such that you will be energized for the next 60 days and you will be working on that. And I'm very happy that you have just 60 days more and this session is going to give you amazing results. Thank you so much, sir, for joining with us today. And I request Parthiban to kindly continue the session. And I think it will be a wonderful session, guys. So kindly listen to him, listen to his tips and tricks, and succeed in your exams. Thank you, sir, and thank you once again.
Thank you very much. Thank you very much to the founder and the chairman, Dr. Raghunandan Ramanathan, for starting such a wonderful platform of medicine. And also, I thank Dr. Parthiban K. Danush for wonderfully coordinating this event. And it's a privilege for me to give a lecture on this topic and in your platform. So let me take you across a few important aspects of 60 days, last 60 days before this INICET PG 2024 has been announced on 16th of April, and the exam date is on 23rd June. Now, before going into the actual crux of the preparation, anyway, you will be preparing, but fine-tuning and consolidating before the exam. What all the things that you need to go through once? So I will just go through once because we could have students watching this could have been an intern or could be a pre-final year or a post-intern, or students who have been preparing for this exam for last 1 year or 2 years, or those students want their specialty of choice, could be for even 3 years. So time, irrespective of time, the passion remains the same to do a post-graduation, and after post-graduation to do a super specialty. Now, the one question that Dr. Raghunandan was asking me, sir, is it possible and how is it possible to get that kind of a mindset to crack these exams? I'll tell you, I was one of the students that you could see the degrees on the board, that I have gone through all sets of examination in the country and outside of the country, both the fellowships and both the masters and the super specialty. All that is available in the country and outside the country. I was able to do it because I was one of the person who has taken the maximum number of entrance examination. If a person like me can do it, anybody in this country and the state and the city can do it. So it is not impossible. But to do anything and to be successful, there are certain aspects that you should learn. And there's a certain discipline that you should learn. And that is very, very important. It is not for only a competitive examination that you need to anything accomplish in your medical career. That kind of set disciplines and the planning is very, very important. And actually, to become a cardiothoracic surgeon was my dream even before I joined my MBBS. So the dream of becoming MBBS or doing a post-graduation is to only become a cardiothoracic surgeon. So that started even before I joined an MBBS, because one cardiothoracic surgeon I could see, in my school days, I'm in 11th or 12th, because one of my known relative went for a bypass surgery, coronary artery bypass. At that time, I could see the surgeon. He was kind of very active personality, the kind of the judgment, the decision, and the kind of the way he was throwing himself and the way he was putting across things was really impressive. I thought one day we should, if at all, have to become like this, to be a life-saving person and should be very active. And that kind of a personality was influential to me. Then I want, okay, fine. To do that, what all things to be done? Then the people said you need to first finish MBBS, then do a general surgery, then you have to go on with that. So I just followed all those processes to attain what I wanted to attain. So actually, in my mind, to what I should do started even before I joined MBBS. Try to understand. See, for certain people, starts after MBBS. Certain people starts after on going through the post-graduation. So it depends on various phases of medical career. One could have what they want to accomplish. They could get influence and can do it. So this is the story. So in my mind, it would have happened after 20 years of my thought process, but it happened before that in the mind. So what happens to the mind, then it goes over a period of process, and the process and the hard work and the persistence and the sustenance, and then it gets accomplished at a particular point of time. So the accomplishment, the time of accomplishment and the time of dream. So the duration between that is just a process to achieve it. So what I'm trying to tell you is, anything that you dream is possible. Anything that you want to achieve is possible. The only thing is that you need to dream nicely. That's very, very important. And your dream has to be complete. Your dream has to be beautiful. Your dream has to be very satisfying for you. The dream has to give you a lot of happiness in you. If that dream gives you that, it is nothing wrong bringing in that dream a reality. I'm telling you, if that is that you wanted, there's nothing wrong in bringing in the reality. To bring into the reality, there are various avenues and the various ways that you can do it. Yes. So it's just a beautiful world around you. There are beautiful people around you, and definitely you can get help out of them, and definitely you can accomplish it. There's no doubt about it. Okay. So there will be certain difficulties and certain aspects in time that you can overcome over a period of time. You have a right kind of people around you that definitely they will help you. They'll advise you to do this way. There are people around me who have been advised me, then I am able to take those help and support. I could make it today. Okay. So let us go through the process. Yes, I'm going to start the process. And one by one, and in between, if you have any questions, definitely you can, I think Parthiban can put into the chat box, and definitely I will be able to answer it. Now, before I could start, I can tell you in a medical career, in medicine, the best part of the medical career, I'll tell you the best part of the medical career is MBBS days. And if all those viewers were in MBBS days, and there are, how many years from now on to complete your internship? That matters. Each and every minute, each and every second, kindly enjoy thoroughly, because you don't get this life. I'll tell you, I have finished my MBBS, my post-graduation general surgery, my MCH, all my fellowship. All this has beautiful days, but the most beautiful days in my life, even today, is my MBBS days. I studied my MBBS in Government Kilpauk Medical College in Chennai. Then post-graduation is also in Government Medical College, Kilpauk Medical College in Chennai. Then I did my MCH cardiothoracic surgery in Madras Medical College in Chennai. Then, of course, MRCS and all those fellowship degrees all happened overseas. That that UK gives the integrated MRCS and fellowships in laparoscopic surgery in US. So all those fellowship degrees and diploma degrees, all those happens overseas in the country. But all these days, the beautiful days or MBBS days, you are not supposed to miss a good day in your college. If you ask me, sir, when should I start my preparation? Should I start in my second year? Should I start in my third year? Should I start my pre-final year and final year? See, when you start does not matter. How you start matters. Understand that. I'll tell you what all steps to follow before you do it. Already you have done it, no matter what. I will tell you what all things that you need to adopt, yes, to make it consolidated and be successful on that. Okay. So the best part of your career is your alma mater, the days in alma mater. enjoyed. Even today, if I have anything, any difficulty, anything that comes in my mind, I just go to the KMC and I just sit under the banyan tree and just relax for some time and come back. So that's how it is. And if for every one of you, you'll have a favorite place in your college. And that favorite place, at any point of time after that, you can come back and sit there and just release your memories and good memories with your friends. Okay. Now let us come to the second point of it. That is, I want to do something after MBBS. So the need of doing a specialization starts, number one, from internal. That means you yourself will feel that I want to do something in my life. And that could be influenced, that could be by when you are into a clinical posting, when you are in third year or second year, second year end on third year, then you go on the clinical posting. And the clinical posting, when you post on surgery or medicine or pediatrics or orthopedics or OBG, wherever the clinical posting is there, you will be exposed to entire arena of medical specialty, and one particular specialty will definitely attract you. One specialty will definitely attract you. And you will start liking it. And that will identify what is in you. What is in you. And for example, you would have gone on an OG posting, and the way the delivery and the labor is conducted, the way cesarean sessions are conducted, then definitely you will see there is a OG in you. And when you go to the pediatrics, and see there is a small neonatal or newborn baby is resuscitated and the newborn baby is taken care, and how after the birth it has been all put up into a proper adequate resuscitation, adequate care, that could influence you. Why can't become a pediatrician? And the way you interact with the child, the way the child responds, the way child gets to the kind of satisfaction that you get, probably you will feel, oh, there is a pediatrician in me. Or it could be a surgeon. The way your chief goes across, there are a lot of people around him. There are assistant professors, and the students and postgraduates. It's a battalion who goes for the ward rounds. And the way he conducts the ward rounds, the way the aura he puts in, you feel, okay, there's a surgeon in me. I want to become like him. Similarly, for a physician, I mean, the way he meticulously he treats, the way he talks, the soft-spoken nature of your chief, those things which could influence you. The patient could influence you. Your chief or assistant professor or postgraduate could influence you. Whatever the way, somebody will inspire you. Whatever the event that happens at a particular point of time, you will feel, this is what I wanted to do. And that will keep on going in your mind. Okay, I want to be a physician, I want to be a surgeon, or an orthopedician, or a physician, or a pediatrician, or a radiologist. I go to the CT scan room and an MRI would have gone. Then see, okay, why can't I become a radiologist? So something will trigger you. So that will be a trigger point which carries on from you the second year to the third year, and by pre-final to final year, you'll consolidate. Okay, this is what I want to do. If after MBBS I want to do something, this is what I want to do. So this will be there in the back of the mind. Okay. So once that comes into your mind, yes, that is going to be the greatest motivating factor. What you wanted to do in life is the great motivating factor for you to do that. So nobody, for preparation of entrance examination, he prepares that I just want to prepare because everybody is preparing. I want to become a postgraduate because MBBS does not have respect. If that is the decision that a student is going to do, he is not going to enjoy his preparation. So joy and happiness in preparation is going to happen only in the process of accomplishment of the dream. That's the reason the very beginning of my talk, I told you that the dream, the complete dream is very important. So what you wanted to do is the greatest motivating factor that could help you to go across this process happily. Now, always I tell my students, what I tell them is, what you want to do is, suppose you want to become a surgeon. What you do is take a selfie, take a phone, take a selfie, then you put it across. Dr. Parthiban, yes, MS, MS, MBBS, MS, MCH surgery, what specialty you want to do, or want to MRCS, FRC, whatever you want to do. Just put it across and take a selfie and type it, put it in a wallpaper and see it every day. Because the phone is what is going to see on hourly basis. Anybody want to do, suppose you want to do medicine, so you want to do MBBS, MD, DM, and FRCP. You just type whatever you want and take a selfie on yourself and put it on the wallpaper. As you open up the screen, you'll keep on seeing that. One day that will become a reality for you. One day, 100%, what you see every day is the reality. Correct? So you fix that first. First, you should know what I wanted to do. Yes. So this is what is the step number 1 for preparation of entrance examination. Correct? So all those viewers today, what you do is just close your eyes and just think, do you want it? And what comes in your mind? And it gives you happiness. That is your specialty. Understood? So what next? Just you keep on thinking we need to fix something. So before we go on to the next step, what we wanted to do. Suppose a student says, sir, I don't have any idea. I don't have any ambition. I don't have any liking for any specialty. Whatever is available, I will take. Then I will tell him, you need not prepare for entrance examination at all. If you don't have any liking for any specialty, there is no need for you to prepare for any entrance examination. Just you need to write the exam, and whatever seat that is available, you take it. Because you don't have any liking for any of the specialty, your job becomes very simple and you will always be happy for it. There is one student, well, like this, I'll give you an example for this. This is a small story which I want to quote. And this student, his name is Dr. Ramesh. He said, sir, the same way he said, sir, you motivate and I mean, a lot of students listen to you and a lot of students want to do what they wanted to do, but I don't have any liking like that. Then I told him, sir, what is your advice? I said, you do not prepare with speed. You don't because not necessary. You want to waste time. You just be happy what you want to do and just write an exam. When you write an exam, any exam, after writing an exam, you will have biochemistry, you will have anatomy, physiology, pharmacology, forensic medicine. All these seats will be available. You can take what you wanted. He said, sir, after the exam, touch my 2 fingers, either of this finger. I asked what? Sir, this is anatomy and this is biochemistry. Which one I should choose? This is what 2 available for me. I said, you can take biochemistry. He asked why. You take biochemistry today. After finishing biochemistry, you will finish before your friends are finishing because you are writing on as a fresher immediately after MBBS. Your friends are going to write after 1 year or 2 years of preparation, and then they're going to get the seat. So you will finish by the time they get the seat. So actually, this is what happened. He finished even before they could get actually what they wanted. And he finished MD biochemistry. Then after that, I told him, no problem. You put Dr. MBBS, Ramesh MBBS, and MD biochemistry. What you do is, outside of the board, you put MBBS and MD. Yes, what people will know is an MD. I mean, people will not know what MD it is. Today, every other person is a diabetic. I mean, there are ways that you can do a diploma in diabetology. There are a lot of courses available. You do diabetology course, and what you can do is, you can start a diabetic practice, common general physician practice, because with the MBBS degree itself, you can do a general physician practice. And morning, you can go to a college, a medical college, and afternoon and evening, you can start your practice. And your life will be so beautiful and happy. And he's happy today. And he asked, why, sir, MD biochemistry you asked me to do? I said, see, later in date, if you feel that you get an interest that I want to do a clinical field, then I want to convert into a DM, within an MD biochemistry, you'll be able to convert that into a DM genetics or a DM hematology. So those provisions could happen if you could do this non-clinical. Even pathologists can do that. Even infectious disease persons can do that. So there is an option for you to convert and change at a later date if you want to do so after looking at your friends at that point of time. And he's a happy person today. So what I'm trying to tell you is, if you don't have any ambition or wish, that probably you can stay calm and you take what is available. And there is no hurry. This kind of personality will always be happy throughout the life. And because they don't have any specific aspects of this, I want this, I don't want. Understood? Now, sir, how do I choose my specialty? This is a very, very important question that anybody asks, because without fixing this, there is no point in discussing the rest of the things, because this is what you want to achieve. Only for that you are working. Understood? So what you need to do is just close your eyes for a minute, and that what comes before your mind, that this is what you like, and that is your specialty. And there should not be any resistance to that. Could be a surgery or medicine or OG or an orthopedics or a gynec, whatever it is, whatever comes into the mind. Do not ask others, sir, if I take this, my life will be good. If I take this life, anything that you take, your life will be good in medicine. Everything has a need in this country. So anything that you take will be happy. So no matter what, whatever you want to do, you can do and you'll be happy. And scope is there for everything. All that you need to do is what suits you, your personality, and what makes you happy is the most important decision that you need to make. Understood? So once you decide that, so you have decided, so, okay, fine. I want to take medicine. I want to become a physician. That's it. You stand by it. Finished. Don't keep on changing from this to that. For that decision, you can take in any amount of time. But once you have decided and final decision, that decision you need to stick on. From that day, you say, okay, this is the brand that I want to carry with me. Today, I carry as a surgeon, as a cardiothoracic surgeon. This is the brand that Dr. Vinayak wanted to carry. This is what I want to be. This is what the people want to see me. This is what I like. This is what I like on me. Similarly, you should have something to carry that you like. You can't live with something that you don't like. So you need to be very comfortable with what you want to live with. Correct? So you have decided that, okay, fine. It could be any specialty that your heart says that you wanted to do, that you want to decide on that and stand by it. Once you have decided to stand by it, and from that day, you need to meticulously shape yourself. Meticulously shape yourself. Yes, each and every aspect of yourself has to be shaped accordingly. I always remember one dialogue from a famous movie called Billa 2 by Ajit. It's a very, very influential dialogue that I always love for myself, and also I quote this for the students. Just listen to this audio and video. You will definitely be mesmerized, and that's what you want to do it. You can run it.
என் வாழ்க்கையில ஒவ்வொரு நாளும் ஒவ்வொரு நிமிஷமும் ஏன் ஒவ்வொரு நொடியும் நான் செதுக்கினது.
Play it once more.
என் வாழ்க்கையில ஒவ்வொரு நாளும் ஒவ்வொரு நிமிஷமும் ஏன் ஒவ்வொரு நொடியும் நான் செதுக்கினது.
See, this is what I want all my students, all the viewers to have in you. You need to shape your life. Nobody should give you a life. If you want to do something, this is how you need to do. Nobody should give. You take this and be happy with that. As doctors here are not used the mind, we used our emotions to get into the field. If you would have thought by mind, would have been in a better profession or other than medicine, not in better profession, nothing better than medical profession, but in other financially better position, I'm trying to tell you. The best profession is medicine, no doubt about it. But financially better position or a number of options are available. But this is of a passion and emotion we were into it. So in that situation, we are known to hard work. We are known to persistent hard work. And we can achieve whatever we wanted to in our style. This is the way it has to be achieved. Okay. Now, once you decide what you wanted to do, nobody can stop you. And nobody should stop you. Yes, nothing will stop me from reaching my goal. This is the goal. What the goal that you achieve, that should be in your, that should be your focus. Nothing else. That should be in your mind. One day or other, I will achieve it. One day or other, I will achieve it. It is the matter of time, nothing else. I am for it. I am coming. Correct? So understand, there is one famous dialogue from Vijay I always quote. Just listen to this. So play this.
ஒரு வாட்டி முடிவு பண்ணிட்டேன்னா என் பேச்ச நானே கேட்க மாட்டேன்.
Play it again. So once you decide, yes, play it again.
ஒரு வாட்டி முடிவு பண்ணிட்டேன்னா என் பேச்ச நானே கேட்க மாட்டேன்.
This is the stand that you need to take. This is the stand that you need to take. You should not even listen to you. That means you have already decided to do that. So this framework, this structure, what I am trying to tell you is the very, very initial preliminary steps. Probably most of you would have crossed it. But I am just doing from the beginning so that those students have not yet decided, this will be helpful for them. Okay. Now, how to start your preparation? That's a very, very important question. Those students already started. Okay. You can just look into what all you have done and what needs to be done in kind of final correction to get on to what you wanted. Okay. Those who are yet to start, this will be very useful for you. How to start the preparation? What is the most important aspect of preparation? Next comes variety of coaching centers are available. Which one will I choose? Which resource I will choose? There are roads which grows under different directions. There are various recommendations by my various seniors. There are online platforms which are available. There are offline platforms which are available. Which one will I choose? There are plenty. In YouTube, they are available. Everywhere the content, the resource. It's not like those days. There's only books that are available that I read from that. Only there are offline classes which are available, I read from that. No, it is today in the era of technology. Everything is available on the mobile. So what will I choose? Correct? So this question is very, very important. I'll tell you, if you choose a right resource, it is not half done. They always say, no, you make a right decision at a particular point of time, it is 50% done. I'm saying it is 100% done. So the choosing of the right resource is the tricky point here. The resource is taken today in medical careers only one aspect, the advice of seniors. Those seniors which are immediate seniors and 1 year immediate, what they say is a Taraka Madra, even in our days and your days as well. You listen to that. But there is a missing chain which is available here. That means we don't do research on this. Before even do a research, for what we should do research is very important. Correct? I will tell you that. So I will tell you the secret. Okay? What is right and what is wrong. Yes, it is not to tell you this is right and that is wrong. Today, whatever is available in the market, everything is good. Let it be an offline, let it be an online, every platform is good. There is no second thought about it. Whatever you have in your hand is good. Whatever is available is good. Everything is good. Then why things are not happening? Why things are not moving on? Okay, there's a secret behind it. I'll tell you that. The most important is not the resource, is not the coaching, is the person who's doing it. Suppose any of the online or offline platform, first and foremost research that you need to do is who is running it? Who is the person doing it? What is his vision? Why he needs to do it? Is it done? See, not only preparation for entrance is done in passion. Even teaching is also done in passion. Only if teaching is done in passion and preparation is also done in passion, both will match. Only that will give you results. If the teaching is done only for a business perspective, the passion is for business. The passion is not to teach, suppose I'm telling you. But always the student will have a passion to learn. They may not match. So the first step is to get the right mentor. See, when you go to a clinical posting, of all the available teachers, one teacher will attract you and you will like him a lot and he will be friendly with you. And with that person, you will move along and he will become a friend even after your MBBS. Similarly, there are various platforms which are available. There are good mentors which are also available. You need to choose the right mentor first. Not the right resource. And all the resources are the same. Almost the same. Not the same. Almost the same. Whatever is available. Because only then they can stand in the market or they cannot stand. But what is most important is, whatever the online and the offline platform that you choose, who is the captain of the ship? Who is the mentor of it? And how he will help you and tell you how to use what you're using. See, all the online platforms which are available is a book of encyclopedia. Apart, it was earlier, it was in a print form. Today, it's in a digital form. That is the difference. But how to use it? See, there is a Harrison book. How to read it? There's an online platform. Plenty of information is available. How to utilize it? Who is going to tell you that? Who is the person? The person who is made only can tell you. See, if I have made something, only I can tell you how to use it. So you need that person first. So that person is only going to guide you. That person is only going to handhold you. That person is going to help you out to reach what you wanted. If that person is not available, then you are nowhere in the sea. So you are in the blue ocean. Yes, you have to swim across for very long years. Yes, and you will become a mentor by yourself. And then you will start mentoring the students of juniors to do what next will be done. So those scenarios you need to understand first. Now, how to find a right mentor? That is the first step. In entrance coaching, identifying the right person is the most important. It is not the right coaching center. The coaching center run by whom? Who is the person doing it? Who is the mentor? Who's the right mentor? The mentor should have a passion. He should have a passion to teach because he has achieved something that he wants to transform the same to his students. Is that the passion? Is that the primary aspect? That you can definitely judge. Then that you can hear say from your seniors. That is what you want to do. He should be trustworthy. He should be a good person. He should have a capacity to transfer the knowledge. And whatever he says, he should have achieved. That is very important. Only then he can do it. Yes. You ask this question. Today, you use one online platform, for example. You first look into the online platform. First ask, who's the owner of this platform? Who's running it? Of course, there could be teachers in that. Teachers does not, they just give transfer of knowledge. They don't do anything other than that for that subject. In what idea this was made and how you to utilize everything and what's mental support he gives through this. It is not just the subscription and collection of fees. And after that, whatever you want, you use it accordingly. No, it is not the way. Entrance exam does not work that way. Entrance exam does not work that way. If you go to a coaching center after 1 year, you don't get a seat, that means coaching is a failure. You are not a failure. Understand that. The mentor is responsible for your success. That's the reason why you go and join him. If you go and join in a coaching center and if it is not done within a year, then that means that coaching is not working. At the maximum 2 years opportunity can be given. Other than that, that means that is not appropriate. That's very, very important. So commitment, honesty, and should be a role model. The person should be a role model. That is very, very important. Okay. So mentoring is not just giving you a resource. Mentoring is not bringing a teacher and making him to teach to you. No, it is not that way. You should first motivate you. You should make you understand what is necessary and what is important. You should guide you first. You should advise you first. How to reach the success. He should give you the roadmap. You should give you the right direction, what to read, when to read, how to read. In 200 questions of entrance examination, the 3 most important subjects are surgery, medicine, and OG. You know that? If you cover surgery, medicine, and OG, it will cover 120 questions. Medicine alone will have 50 questions because medicine is not only medicine. Medicine will have psychiatric question, dermatology question, pharmacology question, physiology question. You can answer to that. Surgery will have another 40-50 questions because surgery is not all surgery alone. You can answer anatomy, pathology. Yes, those allied radio diagnosis, all those you can answer through surgery. OG will have standard 30 questions. So 50 plus 40 is 90, 90 plus 30 is 120. Yes, and if you add ENT Ophthal, I'm telling you, it's a rule, finger rule, thumb rule. ENT Ophthal, orthopedics, pediatrics is 5 to 8 questions. That becomes another 30-40 questions. So 150 to 160 questions, you just get through clinical subjects. That means in 19 subjects, somebody should tell you this. It is not that to advise all 19 subjects. Of course, you need to read 19 subjects. But out of the 19 subjects, which are the priority? What are the priority subjects? That is very important. So any of the platform that you're using today, this is what you mean required to know. First, in any entrance preparation, 60 days from now, what do you need to finish first? Surgery, medicine, OG. Then what do you need to do? ENT, Ophthal, pediatrics, and orthopedics. How many subjects? Surgery, medicine, OG, 3 subjects. Pediatrics, orthopedics, ENT, Ophthal. Totally how many subjects? 7 subjects. First, give this priority to 7 subjects, which covers 150 plus questions out of 100. You got the maximum. And after that, any of those 50 questions from Anat, Physio, Biochem, Path, Micro, ENT, Path, Micro, FM, Community Medicine, Skin Anesthesia, Radio Diagnosis, Psychiatry, you can just prepare through MCQs also, through your notes also. This is what is important. So this is the direction that you need to know. And mentoring is not only coaching. Mentoring is all about support. Mentoring is all to achieve the goal. You need to make the student understand what he wants to achieve. And training. Training is not general training. Even in subject, there are various ways to help the students to understand. If a student does not like the subject, does not mean that student is not liking it. That means the teacher is not able to make him like. Teacher should inspire him to like the subject. A good teacher, even a difficult subject, he can inspire and make the student like it. It's very important. So mentoring is very important. Now, how I should compare this? No, Chennai Super Kings. The mentor and the captain is MS Dhoni, correct? You tell me, is Dhoni most important or the team members most important? Of course, there's need a team to play. But who makes a difference for CSK? You tell me, sir. Who makes a difference for CSK, sir? Obviously, Tala Dhoni makes a difference. If not for Tala Dhoni, there's no CSK at all. I can tell you. The entire Chepauk is full of, the stadium is full only for Tala Dhoni. Yes, he is the person responsible to achieve the cup. Though other players have the skills, but he is a person, is utilizing each and everybody's skill for the success of the team. So you need to correctly identify this mentor and the captain for you first. Once you identify, you go and hand over your preparation to him and say, sir, I want to do this. So kindly help me to do so. And he will definitely help you out. He will definitely say, okay, I will do it for you. Yes. So that's how it works. The enthusiasm and the energy and the achievement of the mentor and the captain that influences not only the students, influences his own team members. Yes, the way the captain and the way the mentor behaves, the rest of the teachers in the coaching center also behave. Understood? The way they do as a team. Yes, who is the person holding it? The entire crowd on the team is Captain Dhoni. Yes, play it. The minute he enters.
Let's have applause, guys.
What a difference it makes. What a difference it makes. So this is very important. Okay. So team and team members are very, very important. In speed, we have the best of the team. I'm just telling you. Yes, the team of the faculties in Speed Medical Institute is something unique like CSK. Now, once you get on to the right mentor and the right captain, you can hand over your preparation to him. And from that point of time, you can relax and just do what the mentor says and just follow whatever he says. He will handhold you and get the job done. If that is not the process, there is no point in joining any coaching center. Joining a coaching center is to give the responsibility. Just register, give the responsibility to them, let them carry out. That's what they are meant for. That's what the expertise is for. It is not like that we pay the fees and register. After that, they give you set of books and set of app and say, with this, whatever you want, you do. That is in a supermarket buying things. That to do cooking for ourselves. Yes, coaching center is like a restaurant. We go and pay for what you want and they give what dish that this has to be served. It is not like a cooking that go to the supermarket and buy brinjal, onion and then to cook. Then why we should? That is not coaching. Coaching is this. So mentorship is this. This is what is very important. Okay. Sir, you can ask me a question. Sir, how coaching center and a mentor could take 100% responsibility? Yes, to assure the results. I'll just ask you a question. You are a surgeon. When a patient comes to you, you will tell the patient that I will try my level best to operate on you. At times I get good results. At times I don't get good results. If I get good results, it is good time for you. If I don't get good results, it's a bad time for you. I am an expert. I have done thousands of surgery. Of that, most of them are successful. You might be successful, you may not be successful. Is this answer acceptable? Is this answer acceptable? This is what the career is all about, na? This answer is not acceptable. Of course, complications are bound to occur. But for those complications, you need to stand by it. As a mentor, as a team, as a center, you need to stand by it. So, I've just made one part of the story done. Is to choose the right, not the right coaching center, the coaching center with the right mentor and his team. That's very important. Understood? Now, examination techniques. Let's go on to the next step. The examination techniques is all about follow what the mentor says 100%. Don't buy multiple resources. If you have decided and want to trust one resource, be 100% to it. You buy one this, one that, and just then finally, how will you revise? See, whatever you read, if you don't have time to revise, it's a waste. You read for 6 months and you don't revise those what you have read for 6 months, that 6 months is waste. So, you want to read from multiple resources, there is no mechanism to revise from multiple resources. So, first decide what resource you want to do. One resource you do. There will be, see, your friend might be doing something, he might be doing something. Don't look on all to that. You do the research even before you have started doing it. And after doing it, no matter what, believe in completely. Whatever the resource you are using, believe in completely. Have a trust in that. And follow what the mentor says, what they wanted you to do. Then it makes a sense. With all what they say, the 4 important preliminary points that you need to have in your mind, because this is going to be a long preparation. It's going to be 6 months to 1 year of preparation. You need to have a positivity in you. You need to have a positive attitude and mindset. Positive thought process and a mindset. That means no matter what, I mean, for this entire preparation, I will have a positive mindset. I will not feel low. I will not go down. I will just be energetic. It is not only the start of my preparation. I will be energetic till the end of the preparation, even on the day of the exam. Until I give the day on the exam, I give me the best to the exam so that the exam gives back me the best to me. It's very important. The positive attitude and the mindset is most important. Clear? The next is, whenever you want to do something, there will be some negativity coming in within you. Not doable, difficult. 1.5 lakh students are writing for this exam. How I can win this exam? I am studying in this private medical college. My seniors have not done it. What are my chances I can do it? Lot of negative thought process can come. You will feel 19 subjects are there. I have done only 5-6 subjects. 13 subjects I have not touched. What are my chances to get the seat? There are so many reasons that will come within you to stop you what you're doing. That you should stop first. It is not the external battle, it is the internal battle that the person who is saying within you, not doable, not possible, I cannot do it, I don't have capacity to do it. First, ask him to shut his mouth and tell him, I have decided to do this, nobody can stop me. You keep on telling this. And this is Vijay dialogue. Once I have decided, I cannot stop by myself. That is the most important dialogue that you need to understand. Yes, and you stop those negative thought processes which are coming into you and stop it completely and say, I want to do it. Correct? So win the battle in the mind. Very important. And be focused. What do you want to do? You want to be a surgeon, you want to be a physician, you want to be an orthopedician, or an OBGYN, whatever, or radio diagnosis, whatever you want to do. Be only focused on that. Be only focused on that, nothing else. What is your dream? Keep thinking of that. I want to achieve it. I want to achieve it. I want to do it. No matter what, any difficulty, I'll go through it and I want to achieve it. That has to be there. Be focused. Be focused. This focus will sail you across the negativity in you, if negativity is there. And it will sail across. All difficulties are going to come during your preparation. Yes, very important. Hard work. Sincere, consistent, persistent hard work is very, 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 very important. A sincere, a persistent, and a consistent hard work is very important, that you will not stop. Once you start, until the day of exam, during the day of exam, until then, this dedication has to be there to complete the process. People, when they start fresh. They start with more energy. After their slump comes down, again they want to do before the exam, and they feel, okay, not possible, and again go back. No. Once you start, the same pace has to go on. And there should be a motivate. The mentor will motivate you to do so. The mentor that you are going to choose, or you have chosen already, ask him, sir, I'm feeling this. Kindly help me out. I'm feeling low. I'm not motivated. I don't have an energy to do so. Kindly say something words, good words. I can be motivated to do so. Okay. So dedicated hard work is very, very, very important. Feel good. You need to have feel good. That means in a preparation, you need to have good friends. You need to have good group and good study group. Don't study alone. I request all of you. Those who are preparing for any entrance examination, let it be NEETPG or INICET PG or an FMG or super specialty exam, any competitive entrance examination in medicine, kindly do not prepare alone. Prepare. Find a good circle of friends. You have friends, study with them. Be with them. So you sail this journey along with your friends. The time will just fly and you will feel not too much of stressed, and you will just go on with your friends. The same journey that you had in your college days, post MBBS days also, you'll have the same journey with your friends, and it will soothe you and it will bring down your stress and you'll be able to achieve. So feel good. Always be with your friends. Don't be alone. Okay. Now, let me come to the subject. I have covered the general aspects of preparing for entrance examination from the start till preparing for the subject. See, preparing for the subject is an art. Preparing for the subject is an art. You have beautiful, very good expert faculty members are available today in the country. Just they can give you the flow of the subject just like that. They can make you understand easily. But there are inbuilt tips, inbuilt tricks to derive an answer even if you don't know answer, because it's a multiple choice question. It's not a theory exam. Among the four, you need to choose one answer, correct? How to choose, correct? See, all entrance exam questions are taken from standard textbooks. I'll teach you the secret. And how to prepare, how to be focused. Whenever you study a theory, how to derive MCQs out of the theory. I will teach you this today. None of the 5 minutes. Do you have time, Dr. Parthiban?
Yes, sir. Yes, sir.
No?
We have time, sir.
So, I mean, can I go for another 5 minutes?
Yes, sir. Yes, sir. You can, sir.
Yeah.
No problem.
So, everything is okay? No problem?
Yes, sir.
Yeah. See, there's a question which I put across. I think you can answer this question. The number of minor salivary glands. This is how a factual question appears in entrance. See, in entrance exam, you could have factual question, concept-based question, problem-solving question, you could have an image-based question, listening, assertion, and match the following. All that can be. I just give you some varieties to you. Just you take it, and I'll just tell you how to build an answer for this. Can you answer this question? A, B, and C. 40, 50, 500, 800, 3000. What could be the right answer? Or the students available in the chat box to type some answers? Yes. See, I always believe in an interactive session. I want to listen to the students and just want to listen from them what options, 1 or 2 options that they could give. They can just type in the chat. It'll be really great. Okay, fine. Let me give you the right answer. Can I give you the right answer? Yes. The right answer for this question is 800. See, 800 are minor or accessory salivary glands which are distributed throughout the upper air digestive system. I'll just go slow. There are 800 number of writing pad. 800 number of minor or accessory salivary glands which are available, correct? Which are available in the upper air digestive system. Now, to know this concept, one question will always be targeted on the salivary glands. It's a salivary gland based question. One question always on salivary glands. I'll just teach you in simple words. Okay. So, salivary glands. See, in salivary glands, what are the major glands? The major glands are parotid gland. Number 2 is submandibular gland. Somebody has answered as B, 500. So it is actually 800. So where do we pick up these questions from? Go back to the slide. And because we have to tell them the reference, because the reference is the most important. Okay. And you can come to the PowerPoint slide and you will find the reference. Bailey and Love, 28th is a recent edition. And all the entrance exam questions are taken from standard textbooks. Understand this, standard textbooks. See, Bailey 20th edition, page number 831 says surgical anatomy of salivary glands, 3 pairs of major salivary glands, parotid, submandibular, and sublingual, and approximately 800 minor salivary glands. No doubt about it, right? See, there are ways that to put the concepts and the facts straight to the long-term memory. There are ways to do so. I can do so. I can teach you today and you can remember for your life. Because it is always to be anecdoted, always to be combined with a story, with an experience, so that it remains the long-term memory, at least to the short-term memory to some extent, so that you can revise and you can recollect at least on the day of the exam. Very important, right? Go to the writing pad. So let us try to understand. Minor or accessory salivary glands, they are distributed throughout the upper air digestive system. The major salivary glands are parotid, submandibular, and sublingual. See, this salivary gland tumors, sublingual salivary gland, I can just finish in one simple table and teach you that this is what they will ask you. I'll tell you, see, this is the parotid gland. Parotid gland has two lobes, superficial and deep. What are the MCQs that could be asked? This is superficial lobe, this is the deep lobe. Correct? What is the percentage of superficial lobe? What is the percentage of deep lobe? Is it 50-50, 60-40, 70-30, or 80-20? What is the percentage of superficial lobe? This is the way you need to learn. The theory has to be reformatted for the entrance purpose. So superficial gland is 80% and deep lobe is 20%. And I'm repeating again, superficial lobe is 80% and deep lobe is 20%. And it is drained by a duct called parotid duct, otherwise called Stenson's duct. And this Stenson's duct, what is the length of Stenson's duct? This is again entrance exam question. The length of the Stenson's duct is 5 centimeters. And the Stenson's duct opens into the buccal mucosa. Buccal mucosa, opposite to the crown of second that is maxillary molar. Second maxillary molar. What is the most common pathology in the parotid gland? It is a tumor. What is the most common tumor of the parotid gland or all the salivary gland put together? It is located in parotid. That is pleomorphic adenoma. So this is pleomorphic adenoma. And immediately they'll ask you the treatment of choice for pleomorphic adenoma. I'll just finish then and there. The treatment of choice for pleomorphic adenoma, because this pleomorphic adenoma most commonly located in the large volume of the gland. The large volume of the gland is located in the superficial lobe because 80% of the gland is superficial lobe. So the pleomorphic adenoma, the most common location is also superficial lobe. So you have to remove the complete superficial lobe. And removal of complete superficial lobe is called superficial parotidectomy. Or chapter closed. Now, let us come to the deep gland, that means submandibular gland. The submandibular gland has two lobes, superficial lobe and deep lobe, and they are drained by a Wharton's duct. And they'll ask you, what is the length of the Wharton's duct? The length of the Wharton's duct is again 5 centimeters. And it opens onto the either side of the lingual frenulum. Either side of the lingual frenulum. And what pathology is more commonly seen in submandibular salivary gland? Stone disease. And what is the treatment of choice? What is the treatment of choice? You need to know whether the stone is there in the duct or the stone is there in the gland. Correct? If there is a stone in the duct, you will do marsupialization, lay opening of the duct. Marsupialization. If it is there in the glut, you do total parotidectomy. I'm sorry. Submandibular gland excision. Submandibular gland excision. I'm sorry. Subconscious misfiring happened. Okay. So, submandibular salivary gland has a superficial lobe and the deep lobe, and it is divided into superficial and deep. Yes, by a muscle called mylohyoid. Mylohyoid forms the floor of the mouth or the oral diaphragm that divides the superficial and deep lobe. Okay, very, very important. So, submandibular salivary gland, stone disease is more common depending on the location of the stone. 80% of the stones are radiopaque. Understand this. They'll ask you this question also. In case of a stone in parotid, 80% are radiolucent. This is how you need to learn. This is how you need to learn. 80% are radiopaque. Stones in submandibular gland, 80% are radiopaque. And 80% of stone are radiolucent in parotid gland. Understood? Now let us come to yet another important gland is the sublingual salivary gland. Now sublingual salivary gland has an important aspect that the ducts are very small. They are directly opening into the buccal cavity. There are sublingual gland duct which can also open into Wharton's duct. The small duct that opens into the Wharton's duct like this. They are called duct of Bartholin. They are called duct of Bartholin. That duct that opens directly into the buccal cavity is called duct of Revinus. Now, these small ducts can get blocked and can cause retention cyst. This mucus retention cyst is called ranula. So, you attended my class today. I'm giving you one exam question today. Any exam from today you take, the chances of this question appearing is very high. And they'll ask you, ranula, what is ranula? Ranula is a mucus retention cyst. It's an exam question, sir. Ranula is a mucus retention cyst. Treatment of choice. Next, treatment of choice. Total excision. Finished. See, yet another important entrance exam question, always they ask in every exam that I want to teach you today. Yes, with regard to salivary glands, with that, I'll finish this class in 5 minutes. See, this is the superficial lobe of the parotid. This is the deep lobe of the parotid. I said 80-20. Correct. There are 3 important structures or 4 important structures I can tell you. This is about the branches of external carotid artery, which is there between superficial and deep lobe. Then the tributaries of retromandibular vein. Tributaries of retromandibular vein. Okay. And very, very important is the facial nerve. The facial nerve trunk, which goes and comes out and divides into, okay, cervicofacial, zygomatico-temporal. So zygomatico-temporal goes to temporal, zygomatic. Cervicofacial divides into buccal, yes, marginal mandibular, and cervical. So this is temporal, zygomatic, buccal, marginal mandibular, and cervical. Cervical. This is facial. And yet another important structure which is there in the substance between superficial and deep lobe or the parotid lymph nodes. So lymph nodes. And so these structures are bifurcation of external carotid artery and branches. This is about retromandibular vein. Now, entrance exam is not to know what are the structures. They'll ask you this question. So there are 4 important structures I'm trying to tell you. So I'm going to finish another 2 minutes. Retromandibular vein, number 1. Number 2, external carotid artery and branches and bifurcation. Number 3 is facial nerve. Number 4 is lymph nodes. They'll ask you anatomical landmark. This question is very, very, very important. Anatomical landmark. Anatomical landmark of fasciovenous plane of Patty. Fasciovenous plane of Patty. You know what is the answer? Among the other options. Retromandibular vein, external carotid artery branches, facial nerve, and lymph nodes. The answer is retromandibular vein. This is the exam question, sir. Very, very, very important. I'm giving you the second question for the day. Understood? Say yes or no? Yes. This is how we need to learn. This is how beautifully we need to learn. Each and every point has to be enjoyed and to be learned and ready-made. There's no time for you to think in 30 seconds. You can only read the question. You can't think. They ask you, what is the length of the Stensen's duct? 5 centimeter. What is the length of submandibular gland duct? Wharton's duct? 5 centimeter. Yes. What pathology is more common? Submandibular gland stone. How will you treat total excision of the submandibular gland? If it is in the duct, marsupialization. What is the most common pathology? In parotid gland, tumor. What tumor? Pleomorphic adenoma. Treatment of choice, superficial parotidectomy. Ranula, what kind of cyst it is there? Retention cyst. What is the treatment? Total excision. So this is how you learn. Simple language, simple words. So once you just, only less content is required, not more content. Required content is not less or more. Appropriate and required content is most important for a resource for you to revise. Understood? Okay, let's go to the slides. Let us go to the slides. I'm going to finish now. So, according to Bailey and Love, 28th recent edition, it is 800 minus salivary glands are there. Understood? Now, let us look into this question. You will answer by yourself. Once you know the subject, you can answer any question, right? Yes, the opening of Stensen's duct, floor of the mouth next to the frenulum, vestibule of the mouth opposite to lower first molar, vestibule of the mouth opposite to the second molar, vestibule of the mouth next to the third molar. What is the answer? Try typing in the chat box. A, B, C, D. Easiest to do. One student's father asked me, sir, what is this exam, sir? They're giving the question and 4 answers. Why are the students finding it difficult? Is the what area they asking? No, sir, they are giving close options. That's the reason why students are getting confused. But this is the easiest exam. Less mental strain. What is the answer for this? The right answer is, what is the right answer? Just now we discussed, na? Stensen's duct opens into the buccal cavity opposite to the second maxillary molar. Second maxillary molar. Understood? Yes. They can ask you another important question. What question they can ask you is, retrograde dissection of facial nerve is done through which branch? They'll ask you this question. In case the facial nerve trunk and the branches are not able to be identified by the surgeon who's operating the parotid, And if he wants to trace the facial nerve trunk, how he can do it? He can trace through the buccal branch of facial nerve because it runs 1 centimeter, within 1 centimeter superior to the sentence duct. It is close to the sentence duct. So if you identify the sentence duct, you will identify the buccal branch of facial nerve. And then once you get hold of the buccal branch of facial nerve, once you walk back, you get into the cervicofacial branch of facial nerve and the facial nerve trunk. Thereby, you will be able to identify the facial nerve trunk. So they'll ask you this. Retrograde dissection of facial nerve. Retrograde dissection of facial nerve is done through buccal branch. Understood? They can ask you one more question. Always entrance exam. In salivary gland, ask you this question. What is tragal pointer? They'll ask you this question. What is tragal pointer? Tragal pointer is nothing but anatomical landmark for facial nerve trunk. It is 0.5 centimeter anteromedial to the tragus. I'm just telling you again. It is 0.5 centimeter anteromedial to the tragal cartilage. It is called tragal pointer. Understood? It is called tragal pointer. Tragal pointer is for identification of facial nerve trunk. Understood? This is simple STEM that I want to teach you. There are more complicated way of teaching it, but I don't want to do so. Okay, just to learn how it should work. Okay, structures present within the capsule of parotid gland. Answer. Structure present in the capsule of the parotid gland. Is it facial nerve, retromandibular vein, branches of external carotid artery, all of the above? What is the right answer? Just now we discussed all of the above. Among these options, of course, lymph nodes of parotid is also there. The lymph node within the parotid gland can give rise to what? It can give to Warthin's tumor. Warthin's tumor. It can give rise to lymphoma. What lymphoma? Non-Hodgkin's lymphoma. Correct? Lymph node within the parotid gland can give rise to this. Understood? So, the anatomical landmark of faciovenous plane of fatty. Faciovenous plane of fatty. Okay? Faciovenous plane of fatty is retromandibular vein. You should understand that. Okay? So, Bailey, 20th edition, page number 831. Parotid, unlike other glands in the body, does not become encapsulated early to form a regular gland. Other structures in the vicinity, including the vessels, nerves, and lymphatics, develop before the encapsulation. So, the gland goes on to envelop the facial nerve, terminal branch of external carotid artery, and retromandibular vein. Retromandibular vein. And see, lymph nodes is also there. Exactly from the recent edition of standard textbook. So, last but one question. I'm just going to complete it. This is the last question for the day. I'm going to discuss today. The most common clinical manifestation of pheochromocytoma, because every paper this question will be there. Symptomatology and management and treatment. I can just finish within 1 minute this question. The right answer for this question is hypertension. Right answer is. This is because clinical manifestation. So it is a sign. But suppose they ask you the symptom, the most common symptomatology will be headache followed by sweating. Understand this. If they ask you most common clinical manifestation, that is a sign, then it is hypertension. No doubt about it. No doubt about it. Understood? Suppose they ask you the symptom, most common symptom, see that. Then it's going to be headache followed by sweating. See, what does this tumor? This is a neuroendocrine cell tumor. What does it do? It produces epinephrine, norepinephrine, and catecholamines. The more amount of catecholamines will increase the sympathetic overactivity. Thereby, the patients will have headache, sweating, orthostatic hypertension, palpitation, tachycardia, tremors, weight loss, hyperglycemia, hypercalcemia, yes, weight loss. All those increased sympathetic activity will be there. Increased BMR, all that will be there. Retinal eye grown changes, all that will be there. Writing pad, please. Yeah. Now, just last 1 minute of my class today. With that, the class will going to come to an end. I'm just going to give you very important answers today. They'll ask you, sir, what is the most common location of pheochromocytoma? Pheochromocytoma is an adrenal medullary tumor. Understand this. Adrenal medullary tumor. Okay, so this is the adrenal medulla. So the most common location of pheochromocytoma is adrenal medulla. Okay, adrenal medulla. You all know pheochromocytoma is a 10% tumor because 10% of the tumor can be bilateral, 10% of the tumor can be malignant, 10% of the tumor can be familial, 10% of the tumor can be metastatic, 10% of the tumor seen in children. So this is a 10% tumor. Correct? Pheochromocytoma, Zell ball in appearance. The second most, this is the most common location. Most common location. This is how they'll ask you. The second most common location, they'll ask you this question. The second most common location is the extraadrenal site. Extraadrenal site is just above the bifurcation of aorta and the origin of inferior mesenteric artery. Understood? This is the second most common location. This is called organ of Zucker candle. This is called organ of Zucker candle. Understood? Important investigation not to be taken. Very important question. Contraindication. Needle biopsy. Needle biopsy should not be done. And diagnosis is only based on biochemical investigation of metanephrin. Metanephrin in serum and the urine. Or VMA, vinyl mandelic acid. And imaging. The imaging of choice is MIBG scintigraphy. Number 1. Number 2, dopamine PET. And equivalent to that is MRI. Next to that, or 3 you can say. And the classically radiological sign produces light bulb sign called bulb sign. Understood? Light bulb sign. So I've told you the most common location, what is about this tumor, and I've told you about the symptomatology and the investigation. No treatment of choice. So the treatment of choice, just in one slide, I'm going to finish. See, the treatment of choice, if it is going to be unilateral tumor, the most common I said adrenal medulla, correct? The most common I said is adrenal medulla. If it is going to be a unilateral tumor, suppose it's going to be a unilateral tumor, and the size is less than 5 to 8 centimeter, then you do unilateral laparoscopic adrenalectomy. Correct? Suppose the size of the tumor is more than 8 to 10 centimeter, then you do laparotomy. This is open surgery. Laparotomy. Understood? If suppose the tumor is bilateral, this is what they want to ask you. 1 minute you can finish one topic in crisp. What you need to know is this tumor the size comparable to the opposite side? This is big, this is small. Correct? Now, what you need to understand is, if it is bilateral, on the side of the big, you do total adrenalectomy. On the side of it is small, yes, you spare the cortex. So it's called cortical sparing subtotal adrenalectomy. So I'll repeat this. So unilateral pheochromocytoma, depending on the size, you will decide to do laparoscopic or laparotomy. Suppose it is bilateral tumor, you have to do cortical sparing subtotal adrenalectomy. That means on the side it is bigger, do total. On the side it is small, remove only the tumor and preserve the cortex. Finished. So we are almost done for the day. Go to the PowerPoint slide. With that, I think I'm going to come to an end. And PowerPoint slides, please. Yeah. So this is a simple question that I'm not going to discuss because of want of time. The lipodermatosclerosis, I made a reel also. I can just put it across. You can see in your YouTube channel. Lipodermatosclerosis is most commonly seen in chronic venous disease. And chronic venous disease also can lead to marginal ulcer or scar. Marginal ulcer or marginal scar can lead to what? Squamous cell carcinoma. Most common location of ectopic kidney. There is a reel on this also, a detailed reel. I can post you across in your channel. You can see it. Most common ectopic location of the kidney is pelvis. Pelvis. The most common embryological malformation of upper tract is duplication of renal pelvis. Number 1. Embryological abnormality of the lower tract is ectopic urethra. It is hypospadiasis. Understood? So, embryological abnormality of the upper tract is duplication of renal pelvis. And lower tract is ectopic urethra, opening of urethra, it is hypospadiasis. Horseshoe kidney, there's a question. Horseshoe kidney is the most common fusion of fused ectopic kidney or fused kidney. There is a fusion, lower poles gets fused. Yes, so that is different. And that is also an embryological abnormality. That's the most common type of fusion. Understood? So this is what I want to just tell you an overview. I think I have done the classes. See, in your preparation, there are times that you can go down. Whenever you go down, always remember this dialogue. Play it.
நான் வீழ்வேன் என்று நினைத்தாயோ
Play it again.
நான் வீழ்வேன் என்று நினைத்தாயோ
See, there are
நான் வீழ்வேன் என்று நினைத்தாயோ
needed. One subject you will get. Number two, to put the subject in the right place and the right perspective, you need constant motivation. Number three, good feel, good well-being, and good health. These are very three ingredients for success. Okay. So, and for this upcoming exam, we are coming up with a crash course because exam is announced. We have the best faculty in the country. And I mean, we have put out the banner. You would have seen all this faculty there. I mean, there in the social media also. And we all come together to boost the rank. Suppose last year your rank, suppose would have been, say, 5,000, for example, I'm saying. If you want to come within 500, what you have done is, we have put the exam question as a core and have built the exam question into 10x. So that what we have structured is, any question that to be asked in the upcoming exam has to come from the core that we have prepared. So that I'm telling you, you can ask me, sir, if I could come and do this course, what are my chances of getting it? When you can come and do this course, but you should do what all I say. That's very important. If you do that, yes, whatever was your previous score, that you multiply or reduce by 10. So 5,000 to 500. If it is 1,000 to 100. So if I'm nowhere, sir, how to do, sir? If I'm so 50,000, then I'll get a 5,000 or what? No, I will tell you. See, first you need to understand where you go wrong. Once you understand where you go wrong, you first correct the weaker subjects. Those weaker subjects can affect the stronger subjects. Stronger subjects could perform well for you, but the weaker subjects can pull down. Even one subject is weak, that can drastically have an influence on a good subject or a strong subject. So I need to understand individually that what is your background, what you have done so far, why are you going wrong, why are you not good rank. That needs an individual one-to-one sitting and to understand, then to give solutions across and to tell you this is what you need to do to improve your rank. Improving a rank is an easy thing that you follow certain principles, basic guidelines. That if you do, then you will succeed. It is nothing a great Himalayan task. These 200 questions are the questions which are asked again and again for the last 5 years in a different ways and different forms. That you need to figure out and read only that. You need not read from page to page, cover to cover, and opening video to closing video of everything. That is not for you. That is for the people who do a PhD on that. You are not here to do a PhD on this. You are here to get important points in the concepts and to pass this exam to go to the next stage of life. And what you want, surgeon, physician, that you learn comfortably, and what all you want to learn, completely learn from that. Not the 19 subject need to be a master. You need to know what is asked in the subject. You should know what is asked. For that, you have the experts. So you have the experts. They will guide you. These are the things for a must you should know for the exam. 100 questions per day we discuss from morning 8 to 9. This 100 question you attend and see. Are you able to attend? And how many you get correct? Correct means be happy. Not correct means correct it immediately. That 100 you revise. Similarly, for all the other 19 subjects, surgery, medicine, OG, we have 2 days. Rest of all subjects for 1 day. This will give you approximately 205 questions. I assure you, 200 questions are going to come will be directly or indirectly through the area what we're going to discuss in this 25 days. So those students who have been doing for last, say, 1 year or 2 years, if you want to consolidate your revision, so you can say, sir, I have read the platform, I have already undergone a TNT, already have undergone a regular course. How can I use this? See, there is acquisition of knowledge. That you acquired the knowledge through all this. Still, you keep acquiring. When you will apply? You want to apply on the day of the exam? Directly you will go and apply on the day of the exam. The exam should give you the results and then you know your results. No, it is not that way. There are 2 concepts here in entrance preparation. One, acquisition of knowledge can come through what you have learned in MBBS, what your online platform, offline platform have given. That is acquisition of knowledge. Acquisition of knowledge alone does not give you results. Acquisition of knowledge then has to be applied on testing. Yes, subject-wise and grant test you should apply. And not on grant test and subject-wise test which are there available in the app. that are not relevant to the exam. You should have those tests and questions relevant to the exam. Those tests and questions is not to prove the point of any coaching or the resource. Those questions should be exactly the replica of the exam, or to some extent to the area of that exam. That is very important. So that's what I have taken. See, in my 25 years, my experience, I have trained more than 3.5 lakh children or doctors across the country. So we know where they can ask you the question. In surgery, I can know. So similarly, other faculties know which all subjects, where are the topics they can take. Those I have told each and every mentor that from your 100 question, I want those 10 questions or 15 questions, 20 questions, ask me a subject. And for the children who come here and after they learn this question answer, learn that. That comes to the exam, answer it, improve the score, get into the PG seat, and go on what you wanted. That's what is very important. This is what we are going to do in this 25 days from 25th of April to 27th May. Whoever want to do a high productive advanced kind of a revision, or those students who are freshers, who have finished or not done anything, your mindset could be, I will just give this exam and see. Anyway, I have to prepare for 1 year. Let me see after 1 year. No. There is always to prepare and go for the exam is better than not preparing and going for the exam. Just give 1 month of solid preparation. If good rank comes, get a seat and go. Why you want to waste 1 year? Give a honest and good try. And preparing and give a good try. Don't give any trial exams. Okay. So we have classes happening in 2 places from Speed. In Speed Medical Village in Kanchipuram and Speed in Chennai in Mangadu campus. And the schedule is out. And all the faculties have given the questions already and the test and the workbook. Everything is ready for the final lap to booster the rank. And for those to get a good rank, we invite you to do so. And this is the set of faculty that we have for this course and upcoming regular course following that. So we have 2 beautiful campus which were built and dedicated for entrance purpose. I have a lot of passion. I did this. And Speed Medical Village is in Kanchipuram in 150 acres, exclusively built like a resort for the students to come and stay and study. Speed in Chennai campus is in Mangadu. That is also a very good campus where the Sure Shot 5.0 happened by Dr. Nikita Ranwani. The most of the students attended. So we are very passionate in teaching you and getting you across because we have gone through all that. We have know what it means. So definitely we're able to guide you. So with that, thanks for the opportunity given to me for handling the session today. And I thank the organizers of medicine, okay, Raghunandan, and also Parthiban for giving me this opportunity. Thank you very much. I wish you all the best and all the success in years to come.
Thank you, sir. So now we have some questions, sir, which will be asked by Parthiban. Sir, I would like to request you to switch off the screen sharing, sir, so that we can just record it for our shorts.
Yeah. Yes, sir.
So the most important question everyone are asking is about time management.
Yeah. Come again?
It's about time management, sir. So could you give us a few tips on that?
Time management where? For the exam or preparation?
For the preparation, sir. For the preparation.
See, I have told 60 days of time. Yes. First 30 days to go for surgery, medicine, and OG. I'm telling you again. These 3 subjects can manage the entire show. Yes, previously it was the basic sciences. Now the examination pattern has changed such a way that these 3 subjects, I advise even get 10 days for this. 10 days for surgery, 10 days for medicine, or 12 days for medicine, 6 days or 7 days for OG. This 30 days first. And OG, if you could complete by 4-5 days, you can also squeeze in ENT, ophthalmology, and pediatrics, and ortho if possible. So 30 to 40 days first should go only for clinical subjects because that carries the weightage of the paper. Then after that, the next important subject that you need to focus on is community medicine. Community medicine, then pathology and pharmacology. Because community medicine will have minimum 15 to 20 questions. And where the pathology could have a base for surgery, for medicine. So pathology, again, important. And pharmacology, there will be overlap, so you can read that. And once it is done, then skin anesthesia, radiodiagnosis, and psychiatry. Because these are 5 questions, 3 to 5 questions each. So those questions has to be addressed. And then the basic sciences of anat, physio, biochem, and micro and FM. This has to be given, and last 2 to 3 days time available for last 15 to 16 days. So this is what I will summarize. So first part of preparation, surgery, medicine, OG, and ortho, and pediatrics and ENT and of that. Followed by second set is about community medicine, pathology, and pharmacology. Then skin anesthesia, radiology, psychiatry, and rest of remaining days for basic sciences. I mean, you need to unmute yourself.
Sorry. One of them have asked what to do before the day of the exam. What's your advice?
Very good question. Before the day of the exam, you need to go to the bed at 9 o'clock. Even you go to bed at 9 o'clock, you can't sleep. There'll be little stress and anxiety that how will I do next day? But one thing which is very important is complete rest is very important for next day the brain to work. So whether you get the sleep or not, but you should have your dinner by around 8:30 and go to the sleep by 9 o'clock. And then whatever time you get the sleep, 10, 10:30, 11, no matter what, you sleep. Next day morning, you get up around 6 o'clock. And 6 o'clock, you get up. And first and foremost thing is to freshen up and do a solid prayer and go to the God and tell him that I have done all that I can. Now, kindly don't let me down and kindly give me a paper that from my area of preparation. This is what you need to pray. The prayer is this. The prayer is kindly give me a paper from what I have prepared from my area of preparation, and not only give me a seat and also give the seats to all my friends preparing along with me, so that all of us can get rank at the seat of the choice, so that after the exams also we can be very, very happy. So this will be a prayer in the morning, and after that, don't skip the breakfast. Kindly have the breakfast because hypoglycemia is an important distractor for the exam. So don't skip the breakfast and kindly have a good breakfast. Kindly have some sweets in the breakfast because it can give good glucose level for the brain to work. And you can have a watermelon juice or fresh lime juice that can give very fresh, good freshness in your mind, or tender coconut water. It will give freshness to your mind and energy to the mind, instant energy to the mind. Then go to the examination hall. And a day previous, identify the examination area. Then kindly go there and find a restroom and see to that. I mean, before you go to the examination hall, you go to the restroom and empty the bladder completely. And then go to the examination center and to find the seat. And also again make a prayer. Kindly, I'm opening the system. Kindly give me questions to the known area of my preparation. And then give the exam with confidence. Definitely get good questions, an area of preparation, answer well and get the seat.
Thank you, sir. And this is a question from my side. I'm doing my MBBS now. What is the ideal time to start preparing for NEETPG, sir?
MBBS days has to be enjoyed.
Yes.
MBBS days is beautiful days. This coaching and this preparation will be for throughout your life. For another 15 years, going to be in the coaching industry for you to learn your PG, super specialty, everything. Now, first few years, at least first year, second year, and third year, completely you have the MBBS days. Be completely immersed in your college life. Yes. Then after your pre-final year, after doing your pre-final year, after being in ENT, that's the time that you get. That time you start first what I like. So before joining the coaching, don't join coaching just like that. Before everybody is doing, I have to do it. Don't do that. That does not work that way. First, you identify what you want to do. I told you in the beginning of my session. First, identify what do you wanted to do. Once you have decided, only then you will join the coaching. Only that it makes a sense. Just going and joining blindly is not going to work anything. You're not going to learn active learning. No use. 6 months or 8 months of dedicated preparation will do the job. It is not that you need to prepare for 2 years or 3 years. No. One attempt, sincere attempt and a good attempt and dedication from you, and also a good coaching center and a dedication from the faculty team. If both could match, job can be done within 6 months or 8 months or maximum 1 year. So that you can is possible, that you can do in even your internship also or after internship also.
Thank you, sir. Any more questions? I'm handing over the session to Dr. Raghunandan Ramanathan for closing it.
Thank you so much, sir. It was really eye-opening session, even for me from my side, because as we all aware, there is just 60 days and we have to be getting motivated by faculties like you, because only then we can actually have a positive mindset. And I hope this session will be such a kind of session for everyone. And almost around 350 students who have been watching this session on I hope so it will be like very helpful for them. Those who have went in between the session, those who are like having the session to be seen at the end of the day. So do kindly watch this session. This will be like a wonderful eye opening for everyone. And I would like to thank sir for joining with us today in spite of a schedule and in spite of everything. And I think I can assure one thing from my side as a first-hand experience, which I went to as a center or just a week back. So that was really like that center kept us engaging, I would like to say, because we would have gone to many coaching centers and many classes, but when we are just in about to sleep, and I think a person will be coming towards us with a candy and they'll be asking us to concentrate. That kind of environment is what actually needed. And I thank sir for giving that, because there are centers are many centers are there, many coaching institutes are there, but ultimately what is needed is we have to study and we have to concentrate, and that concentrating environment is what needed. And I think sir is like master in providing that. Thank you so much sir once again for joining with us. So this session will be made available in the YouTube for people, those who missed to watch and those who have been studying and those who have planned to watch at the end of the day. Do kindly watch it. And also the important aspects of this classes will be like cut shorted and will be uploaded shortly by our team, and that will be very helpful. And we have uploaded the schedule as what sir told you as a T&D crash course in the Speed Institute in Chennai as well as in Kanjipuram in our Instagram page. You can very well see that, and the contact number is shared in that itself. So those who wanted to join the session, I think it will be a wonderful decision of yours. So those who are in internship also, if you have already completed your internship, many universities, I guess the internship is completed, so you can also join for this 1 month. So that 1 month, it is not going to be very big for you guys, but it will be like making a wonderful changes in your results. And if I had opportunity during my internship days, during my end of internship, I would have definitely used this opportunity, and I think you guys will also use this and get a benefit out of it. Thank you so much, sir, once again. And thank you, Parthiban, for organizing this wonderful session. And we will have many wonderful sessions in the upcoming days. And one of the best part of this session is this tomorrow is going to be the 4th year of our starting of this YouTube channel. And end of the 3rd year, we are a wonderful faculty with us who has joined us and made this year a wonderful, memorable year. Thank you so much, sir. And we hope so. We will have so many sessions in the future from your side. We will be happy to listen to you, and our students will be highly getting motivated from you, sir. Thank you once again.
Thank you, doctor. Before I close, one closing note I want to give you. One closing note I just want to give you. That is, in my experience of 25 years, what I have seen is any student who has put in a sincere hard work has never failed. I'm telling you again. Any student has put a sincere effort and a hard work. In my history of my coaching industry, which I have seen in my over years of 20 years, he has never failed. Never failed. It could be only a delay. Yes, never denied. Yes, it could be a denial is not failure. Understand that. Delay. Yes, delay is not a failure. And it's every dog has its day. Understand this. Every dog has its day. So you will have your day, and there will be a time for all of us to celebrate. So have that in your mind. Okay. There could be 1 year delay. That is not a failure. It can happen in subsequent time. So sincere effort never fails. So if you have given a sincere effort, always be confident that you will definitely succeed one day, and the day will come for you. Don't worry. All the best.
Thank you, sir. And
Thank you,
one
sir.
from many students in the chat box. So any chance we can attend it online? I think there is no online option for T&D, but then if there is any option in the app, kindly suggest, sir.
Sir, we will let you know about the online options in upcoming days.
Thank you, sir. Thank you so much, sir. And thank you once again for joining with us, sir.
Thank you, doctor.
Thank you, sir.
Thank you.